The day begins like any other. You wake up, go through your usual routine, and everything feels mostly normal. Maybe there's a slight discomfort in the stomach, nothing sharp, just a mild, dull sensation that's easy to ignore. It doesn't interfere with your day. You eat, move around, and continue with your tasks without giving it much attention. It feels like one of those minor things that will pass on its own, something not worth worrying about. As the day moves forward, that mild discomfort doesn't fully go away. Instead, it starts to feel a bit more noticeable. The pain becomes slightly sharper, and you begin to feel less comfortable than before. Eating no longer feels normal, there's a subtle loss of appetite, and even small meals feel heavier than usual. You might start paying more attention to the sensation, but it still seems manageable. At this point, it doesn't feel serious, just something unusual that you expect will settle down with time. By evening, the situation begins to change more clearly. The pain is no longer dull. It becomes sharper and more focused, often shifting toward the lower right side of the abdomen. Simple movements like walking, bending, or even standing up start to feel uncomfortable. The body feels tense, and it becomes harder to ignore the sensation. What once felt like a minor issue now begins to interfere with normal activities. Sitting still may bring slight relief, but the discomfort remains constant. At this stage, it's no longer just an inconvenience. It feels like something that needs attention. By night, the pain reaches a point where it can no longer be ignored. It becomes intense, sharp, and persistent, making it difficult to rest or find any comfortable position. Even small movements feel painful, and the discomfort may be accompanied by nausea or a slight fever. The body feels restless, and sleep becomes almost impossible. At this stage, the situation feels urgent. What started as a mild discomfort in the morning has now turned into a serious problem. It's no longer about waiting for it to pass. The body is clearly signaling that something needs immediate attention. In many such cases, this pattern of pain is linked to appendicitis. This condition occurs when the appendix, a small, tube-like structure attached to the large intestine, becomes inflamed and swollen. As the inflammation increases, pressure builds inside the abdomen, leading to the sharp and localized pain often felt on the lower right side. If not treated in time, the appendix can rupture, which may lead to more serious complications. Because the symptoms can start subtly and worsen over hours, recognizing the progression is extremely important for timely medical care. Treatment for appendicitis usually requires prompt medical attention. In most cases, surgery is performed to remove the inflamed appendix before complications develop. This procedure is common and generally safe when done in time. Delaying treatment can increase the risk of rupture, which makes the situation more serious. What begins as a small, easy-to-ignore discomfort can quickly turn into an emergency within hours. Recognizing the progression and acting at the right moment can make a significant difference in recovery and overall health.